The dermatology and aesthetics market is currently expanding at an 18% annual growth rate. Platelet-rich plasma, or PRP, serves as the primary biological engine driving this surge. At the cellular level, PRP triggers 4 universal healing reactions in the skin: fibroblast proliferation, new collagen synthesis, keratinocyte renewal, and the delivery of microscopic extracellular vesicles. The scale is significant. PRP produces up to a 7.7-fold increase in fibroblast proliferation. When the precise molecular fuel is delivered to the targeted area, the tissue has a clear biological mandate to repair and regenerate. Despite this cellular reliability, actual clinical outcomes in everyday aesthetic practices remain inconsistent. Data identifies the problem. Standard devices fail to reach effective thresholds. The Eclipse system dilutes platelets, and standard gel tubes trap 65% of them. A 2023 trial proved higher concentrations yielded a 42% hair density increase versus just 16% for lower doses. A centrifuge system that fails to concentrate the plasma effectively starves the biological engine, resulting in a treatment that falls below the therapeutic threshold. This is evident in hair restoration, which has the deepest pool of clinical evidence, with 43 randomized controlled trials. It is currently the only growth factor treatment available for female pattern hair loss. Success in the scalp relies on insulin-like growth factor 1, or IGF-1. Out of all the growth factors present, IGF-1 is the singular molecule directly correlated with cell proliferation in the hair follicle. Standard PRP often fails to capture this molecule. Because IGF-1 resides in the liquid plasma rather than the platelet granules, double-spin systems discard it as waste, and single-spin systems leave it dilute. Regenerating a hair follicle requires more than just platelets. It requires a technology capable of capturing the entire intact protein profile. For skin texture, a massive network meta-analysis of 68 trials evaluated acne scar treatments and found that combining laser therapy with topical PRP ranked first among all available combinations. This graph illustrates a central timing deficit. Standard PRP releases 95% of its growth factors in a rapid 6-hour burst. However, human collagen requires a full 7 to 14 days to remodel scar tissue. Successfully bridging that time deficit depends on a sustained-release protein scaffold that feeds the tissue over the entire 2-week remodeling phase. Concentrated plasma demonstrates a versatile regulatory power in pigment correction, successfully treating both the hyperpigmentation of melasma and the complete loss of pigment in vitiligo. For melasma, intradermal PRP ranks as a top-tier treatment because it normalizes the expression of TGF-beta, the specific protein pathway that suppresses the overproduction of melanin. Conversely, in vitiligo, the plasma acts as a melanocyte mitogen, signaling dormant cells to migrate and multiply. When paired with laser therapy, it achieves over 50% improvement, even in resistant acral areas. Overpowering malfunctioning regulatory pathways in the skin requires a high density of growth factors to restore normal cellular signaling. This regulatory action is currently being applied to severe fibrotic conditions. In keloids, concentrated plasma reduces CTGF, the primary marker responsible for overactive scar tissue. For stretch marks, specifically striae rubra, early data shows a 31% complete response rate, though the broader evidence quality remains investigational. Transparency is vital when evaluating these emerging frontiers. For chronic conditions like lichen sclerosus, observational data is encouraging for patient relief, but the only fully completed randomized trial resulted in a negative outcome for PRP monotherapy. Reaching therapeutic thresholds in these challenging early-stage indications requires the highest projected concentrations of both platelets and proteins. PCX by Swiss Concept addresses these biological gaps by replacing standard dilution with an ultrafiltration process designed to fix the quality crisis. By utilizing Deprot Smart 2 membrane, the system is projected to achieve 5.5 to 6 times platelet concentration, while capturing double the plasma protein enrichment. This dual concentration captures the vital IGF-1 required for hair and builds the 12-day sustained-release fibrinogen scaffold for the skin. Genuine tissue remodeling depends on restoring the true physiological proportion of molecules, providing both the platelets and the specific proteins the body uses to heal. This process is efficient. From a patient-friendly 24 milliliter blood draw The system yields a highly concentrated output of 3 to 4 milliliters. This 3 to 4 milliliter volume maps directly to established clinical protocols, covering the requirements for hair mesotherapy, acne scar treatments, and facial rejuvenation. Delivering 3 to 4 milliliters of protein-enriched plasma provides a targeted tool for precision medicine. Measured and definitive. Success in regenerative aesthetics is dictated by the dose of platelets, the composition of the plasma proteins, and the duration of biological release. A rapid 6-hour burst of growth factors cannot match the restorative effect of a 12-day sustained release. By combining maximum concentration with dense protein enrichment, PCX provides a system built for the precise needs of human tissue. This is the projected future of dermatology.